Okay. We are here today at Abishol Coping Clinic, Lusada, Agbara, Aton Road, with the last appointment for Mr. Solomon. Today we want to do both dry cupping and wet cupping on Mr. Solomon. The first video on him is the dry cupping. That's the dry cupping means without incision. That's we don't do incision for that dry cupping. That is just use it to control some pain. It also relieve both lower back pain, arthritis, rheumatism, all the work that the wet cupping also do. That's what dry cupping do, but it is much more effective when we make an incision. That's when the incision the toxin come outside. That's to detoxify the pain that is inside the flesh. That's the bad blood that is under the flesh. That's what we are working on, because we are just pain management. That's as our own practice. We are just a pain management. We work on the flesh. That's the toxin that is under the flesh. That is what we normally work on. Now I will start with the incision. Then after the incision mean wet cupping. That I will be doing incision on the skin. Then the toxin that is coming out from the body, we call it the detoxification. That's we call it bloodletting. They can also call it bloodletting or wet cupping. Wet cupping. Now we are on dry cupping now. When I start the incision now, when the toxin is coming out, then we can now call it wet cupping. Wet cupping. Both of them work the same function, but one is more effective than the second one. The one that is more effective is the wet cupping, while the dry cupping is to just relieve the pain, the present pain that is paining the person. But when we did incision on the person, then the toxin come outside, it always make relief on the patient. That is the thing we want to do now. I'm starting opening the cups on Mr. Solomon for me to perform the incision on him, so that the toxin will come outside and then everything will be okay. Now I've started. You can just off the